The clerk will now proceed to read the orders of the day.
Ways and Means adjourned debate on question.
Now, the question is as on the order paper, and before we welcome Ed Argar back to the dispatch box, I would just like to point out that when we have finished with the front benches, the three, then we will be immediately instituting a 7-minute limit on speeches. Ed Argar.
Thank you, Mr. Deputy Speaker. My right honourable friend, the Secretary of State, is currently at a COBRA determining the next stage of the government response on coronavirus. He therefore apologises he's unable to open this debate. He will, with your permission, be making a statement to the House a little later this afternoon. That will provide honourable and right honourable members the opportunity to question him on the latest position. I would therefore urge colleagues to perhaps pause on specific questions related to coronavirus until that statement, when they will have the latest information. May I also say, Mr. Deputy Speaker, it's a pleasure to be back after last week's precautionary self-isolation, following contact with a confirmed case and on PHE advice. They have subsequently advised me that as I am symptom-free, I can return. Can I put on record my thanks to them for the work they are doing for everyone at the moment, and indeed my thanks to honourable members and indeed constituents for their kind words last week. Mr. Deputy Speaker, coronavirus is the most serious public health challenge that our country has faced in a generation. Our goal is to protect life and to protect our NHS. Last week's budget showed we will rise to that challenge. Under the plans laid out by my right honourable friend the Chancellor, workers will have a strong safety net to fall back on if they fall sick, businesses will get the financial help to stay in business, the NHS will get whatever resources it needs, and all in all, my right honourable friend the Chancellor of the Exchequer announced last week in total a £30 billion investment in the financial health of the nation. And of course I will.
And many of those measures are extremely welcome, but isn't it becoming clear that economically the impact of this is perhaps even greater than anticipated even last week, and that perhaps now's the time to consider a temporary universal basic income for people who are working as freelancers or who are self-employed for the duration of the crisis?
Well, I'm grateful to the honourable gentleman for his comments. I believe that the package announced last week is the right package at this time to meet the challenges posed by this situation. Without going necessarily referring to his particular proposal, I do note the Chancellor continues to keep all interventions under review as this situation develops, but I think at the moment what was proposed remains the right approach. I will very briefly give way, and then very briefly to my right.
I thank the Minister for giving way and underline my support for my honourable friend's comments just then. But I know he said we can wait for the Secretary of State later on, but I want to ask him a specific question about personal protective equipment, because I'm getting a lot of concerns from, and I know this is across the country, about care homes in particular and those involved in domiciliary care, and perhaps also some of the differentials that are going on between private care homes and public sector care homes. Can you just tell me how he's going to make sure that across the whole of the UK, working with the devolved administrations, that people get the PPE equipment they need, particularly in the care sector?
I'm grateful to the honourable gentleman. I can reassure him that firstly we are working across the 4 nations because this needs an entire United Kingdom response, and secondly that we are working extremely hard to ensure that all those on the front line looking after people, keeping them safe, get the protective equipment they need. I suspect the Secretary of State will say a little more about that later this afternoon. I give way to my right.
Very grateful to the Minister. Well, will the Government look again at the issue of the hospitality, travel and leisure industries, where some of their businesses are not just losing 10 or 20% in the way they might in a normal recession, but are losing the bulk of their revenue? Don't they need some revenue sharing with the Government? Couldn't we have a scheme like the German one to keep workers in work for a bit when they have a major loss of demand? I've declared my interest in the register. They're not in this particular sector.
Grateful to my right honourable friend. He is right to highlight the challenges posed to particular sectors by what is happening at the moment, and he mentions the hotel and the hospitality trade, and he's right to do so. I know that alongside the measures set out by the Chancellor last week. My right honourable friend, the Secretary of State for Culture, Media and Sport, continues to have discussions both within his department and across government and indeed with the sector as to what can be done to ensure that they get the appropriate support they need as a sector. Very briefly.
I thank my right friend for giving way. Just to follow up the point that's already been made, I'm getting several cases where businesses are coming to me and saying that their business interruption cover is not being recognised by their insurance companies because coronavirus was not a notifiable disease at the time. Now, if the insurance industries take this attitude nationwide, many businesses, and not only in the tourism and hospitality, are going to go to the wall, and my constituents in the Isle of Wight will be especially badly hit.
My honourable friend makes an important point. I know that the Treasury and indeed my honourable friend, the Economic Secretary, and others are in conversations with the industry more broadly. I believe more conversations are occurring tomorrow to ensure that businesses do get the support they need and are treated in a fair way. Mr. Deputy Speaker, this investment in the financial health of the nation is one that includes £40 million for literal vaccines, research and testing, because we base our decisions on the bedrock of the science. This national response is made possible because of our careful stewardship of the British economy over the last 10 years, because record numbers of businesses are making, selling and hiring, because millions more people are in work, earning and paying taxes, and because we've backed the NHS with a record long-term funding settlement. This is, Mr. Deputy Speaker, a national effort, and we will get through this together, as the Prime Minister has said. In government, we will do the right thing at the right time, working through each stage of our coronavirus action plan, guided by the science and the advice of our medical and scientific experts. In just 1 second, I'll happily give way to the Honourable Lady. We will stop at nothing to defeat this disease, but we will only succeed if everyone does their bit. Washing hands regularly, self-isolating for 7 days if they have symptoms, a new, continuous, persistent cough or a high temperature, and looking out for their neighbours. And in that spirit, may I thank the Right Honourable Gentleman, the Shadow Secretary of State, my constituency neighbour, and the Honourable Gentleman, the Shadow Minister, the Honourable Gentleman for Ellesmere Port and Neston, for the constructive approach they have taken since the start of this outbreak. They are doing their bit. They are good and decent people and public servants, and their approach is a prime example of how we can work together during this crisis. I give way.
Thank the Minister for giving way. One of the questions I'm getting from constituencies who already have medical conditions, they're very worried about any interruption to their supply of medicine and any interruption to their treatment. What reassurances can the government give that people, for example, with epilepsy are still going to get the medication that they need?
What I would say to the Honourable Lady and those listening is that the NHS has robust procedures in place to ensure the continuity of medical supplies. I would urge those in respect of supplies bought over the counter not to stockpile, to behave responsibly and buy what they need. And in terms of prescription medicines, I reassure we have very strong and robust processes in place to ensure that those medicines continue to be available. Of course.
I wonder whether we could consider the kind of language we're using around these at-risk groups of people. Very few people will self-define as vulnerable or elderly, and in fact people with underlying health conditions might not even realise that they are particularly at risk of infection. So I wonder whether we could think about the language we're using and specifically issue guidance to these groups of people.
The Honourable Lady, as ever, makes a sensitive and sensible point. She is right. Clarity around definitions and around the language you use is important. I don't want to preempt what my right honourable friend might say in this House in a little while, but I think she will see in the coming hours and days a greater degree of clarity for people and more information and guidance for people around that. One more before I move on.
For giving way. Now, clearly, we're very early into this. We don't quite know what the business continuity impact will be and the financial impact on business. Does the government have a framework by which it will operate and have discussions? So when Virgin Atlantic, for instance, come forward and say they need financial support, what will be the framework of that support? And what might the government want in return for that investment?
Yeah.
The Honourable Gentleman makes a good point, which almost to a degree goes back to the Honourable Lady's point about giving people greater clarity and understanding of how things will work and in what way. These matters, because they are fast evolving, exactly as he says, continue to be under review, but we will ensure we work with industry in the example he gives and others to give the support that people need and that is most appropriate. Again, I hesitate to say this, but I would, as I did at the beginning, caution slightly. If he waits till the Secretary of State statement, which I think is about 5:30, he may well get more details around this. Mr. Deputy Speaker, coronavirus is the biggest challenge facing the NHS today. With clean hands and calm heads, we can help tackle it together. But we will equally not allow it to divert us from the long-term improvements that patient and staff rightly want to see. As the founders of the NHS knew better than anyone, you can fight the war while also planning for the peace. So let me now turn to the measures in the budget that will secure those long-term improvements. Last week, my right honourable friend, the Chancellor, committed £6 billion of extra spending to support the NHS over the lifetime of this Parliament. This comes on top of our record long-term NHS funding settlement, £33.9 billion more over 5 years, which we have now enshrined in law. Most of that extra £6 billion will go towards delivering our flagship manifesto commitments. That's starting work on 40 new hospitals, 50,000 more nurses, 50 million more appointments in primary care, more buildings, more people, more services. And let me take each in turn. Yeah, of course.
Minister, for giving me, and I would quite honestly say it's an impressive list of capital spending commitments that he's giving us today. He'll be aware the Office of Budget Responsibility have based their longer-term debt forecasts on the assumption that 20% of those capital promises will never actually happen. Does he accept the view of the Office for Budget Responsibility on that?
The Office for Budget Responsibility is independent of government and sets out its opinions as it sees fit. We are committed to that hospital building programme, and if he pauses a moment, I will come on to the detail of that capital spending. So first, the buildings, Mr. Deputy Speaker. The budget increases my department's capital budget by £1 billion in 2020-2021. This will allow trusts to continue investing in vital refurbishment and maintenance, and of course, we are funding the start of work on our 40 new hospitals and the 20 hospital upgrades already underway. That work, I'll finish the sentence and then, yeah, of course. That work to plan and design those 40 new hospitals has already begun. I give way to the Honourable Gentleman.
I thank the Minister for giving way. Halton Hospital campus has been turned down twice for capital funding now, much needed refurbishment. It's part of Warrington Halton Hospital Trust, as the Minister will know. I plead once again to ensure that this is prioritised, and I'm still waiting for a meeting with the Minister. Thank you.
Well, I hear what the Honourable Gentleman says. He is, as ever, a vocal champion for his constituents and his hospital. I say very, very gently that recent events have slightly impacted on my ability to schedule as many meetings as I might wish, but I do, of course, remain committed to meeting him and talking to him about that particular project. Mr. Deputy Speaker, we want those hospitals to be fully equipped with the very best modern technology, touch screens, not clipboards, systems that talk to each other, and we want them to be fully integrated with other local NHS organisations. But, Mr. Deputy Speaker, this is just the start, and we will follow this work up with multi-year capital funding through the spending review to be announced later this year. Turning it, yes, I will.
I'm very grateful. Will he, for the new hospitals and indeed the current ones, is he looking to possibly divide them up between coronavirus and non-coronavirus and having protective suits, certainly in the coronavirus sections? I know in China they've been building a number of hospitals within weeks specifically for this problem. So will he refocus this programme and bring it forward to the coronavirus crisis?
Well, I would say to the Honourable Gentleman that I suspect that Chinese building regulations and similar are possibly a little different to the processes in this country in terms of speed. But He makes a good point. These hospitals, though, are hospitals built for the future, for the next 10, 20, 30 years. We are building hospitals for the future of our country. What I think he alludes to, however, which is an important point, is that we ensure, which is what I was touching on here, that when we build new buildings, they are adaptable and they can be adapted to the changing needs of medical emergencies and the changing, indeed, long-term demographic trends in this country. I would say to him on that front, yes, we are building hospitals that are fit for the future, whatever that future may throw at us, but I think the issue he's raising is perhaps a little more short-term than the length of time it will take us to build some of these hospitals. Turning next to people. The 1.4 million strong team who make up the most dedicated workforce in the world. What's the one thing most NHS staff would change if they could change one thing? What's the best present we could give our nation's nurses? The answer, Mr. Deputy Speaker, and I won't be led astray by the opposition, the answer, Mr. Deputy Speaker, is more nurses. More nurses to share the burden of rising demand. More nurses bringing their compassion and determination to their work in the NHS. And over the next 5 years, we will deliver 50,000 more nurses for our NHS. We will do it by retaining and returning existing NHS staff, by recruiting more nurses from abroad, but crucially, by attracting more young people into the profession in the first place. This budget delivers that by providing new non-repayable maintenance grants for nursing students, at least £5,000 a year for every undergraduate and postgraduate nursing student on a pre-registration course at an English university, with more for students with childcare costs or in disciplines like mental health where the need is greatest. More than 35,000 students are expected to benefit. In the coming months, the British people will have even more reason than usual to give thanks to our nation's nurses, and we will work to repay them by making the NHS the country's best employer. More supportive, more inclusive, more concerned with the well-being of staff as well as patients, an NHS that cares for its carers. We will set out how in our landmark NHS People Plan. We will also tackle the taper problem in doctors' pensions, which has caused too many senior doctors to turn down work the NHS needs them to do. Thanks to action in the budget and indeed the work of my honourable friend, the Economic Secretary to the Treasury, from April the taxable pay threshold rises from £110,000 to £200,000. This will take up to 96% of GPs and up to 98% of NHS consultants out of the scope of the taper based on their NHS income. And I am particularly grateful to my honourable friend for his work on delivering this. Turning to staff in primary care, Mr. Deputy Speaker, this budget funds 6,000 more doctors and 6,000 more primary care professionals in general practice, on top of the 20,000 primary care professionals already announced. Why? Because we want every NHS professional working at the very top of their skills register. Because there are brilliant, if I finish this point, of course, there are brilliant physios, pharmacists and healthcare assistants who can offer great treatment and advice for people seeking primary care, because we can improve patient access to the NHS while freeing up GPs for those who need them most.
While we welcome the numbers of professionals in a range of clinical areas that the Minister has just outlined, could the Minister tell me when each of those clinical specialisms and the numbers in them, when will they be ready to start work, when will they be fully trained, and where will they come from?
Well, I set out to the Honourable Lady in my remarks just now exactly where they would come from a variety of different sources. We have already seen in the latest numbers for nurse recruitment, for example, many thousands more recruited in the last year. We are succeeding in delivering on our pledge, and we set out very clearly in our manifesto the timescales within which we would deliver. Mr. Deputy Speaker, this brings me to my third point, NHS services. I've said I want the NHS to pursue two long-term policy goals: two long-term policy goals that my right honourable friend, the Secretary of State, is committed to. 5 extra years of healthy life and increased public confidence in the service. The coronavirus outbreak demonstrates that you have to target both. It is an explicit goal of our policy not just to tackle the disease, but to maintain public confidence. We take the same approach more broadly in healthcare. We want people to live healthier for longer, and we want people to be confident that the NHS will always be there for them, that it will treat them with dignity and respect, that it will feel like a service and not an impersonal system. We want people We want people to know, for instance, that they can always see a primary care professional whenever they need to. This budget funds our manifesto commitment to create an extra 50 million appointments a year in general practice.
I'm very grateful to the Minister. I'm also very grateful to him for meeting me last week, and I'm very glad that I didn't have to follow him into isolation. We had a good discussion last week, but we talked very much about those health inequalities and that the necessity for more people to have more healthy years. And I was grateful to him for being kind towards North Tees and Hartlepool and talk about a new hospital for Stockton. I hope that, if there is a little bit of capital to get that underway, he will come up with it soon.
Well, the honourable gentleman and indeed my honourable friend, the member for Stockton South, are both strong advocates for Stockton and for the hospital there. I very much enjoyed our discussion. I'm glad that the self-isolation rules are such that he didn't have to follow me into it. But I'm very happy, as I said when we met, to pick up on that discussion further in the future. We also want people to know that the NHS will treat them fairly in their hour of need. It's why we care about hospital parking. Thanks to this budget, from next month we will start the rollout of free hospital parking more broadly across our hospital estate for disabled people, frequent outpatient attenders, parents of sick children staying overnight, and staff working night shift, delivering on our manifesto commitment. She tempts me for a second time. How can I say no?
It's a very quick one. Thank you very much, Minister. It's just to ask if that list could also include students who are on placements at the hospital, for example, nursing students, occupational therapists, any students who are on placement having free parking as well.
Well, the Honourable Lady will know the 4 categories I've just announced or referred to are the 4 categories we explicitly referred to in the manifesto on which we were elected. If she, as she knows, if she wants to write to me, I am always happy to receive and respond to a letter from her on that issue. Mr. Deputy Speaker, the last measure I want to point to may have escaped notice last week, but it's an incredibly important part of putting the service into National Health Service. Too many people with autism or a learning disability are being treated as inpatients in mental health hospitals instead of being helped to live in their communities. In our manifesto, we committed to making it easier for them to be discharged from hospital. This budget makes good on that commitment. It creates a new learning disability and autism community discharge grant that will be available to local authorities in England. This is new money, and all local areas will receive a share of this funding. Mr. Deputy Speaker, Yes, go on.
I'm very grateful to the Minister for giving way. On that point concerning people with autism and learning disabilities in assessment and treatment units, can he advise on the arrangements that are being made during the coronavirus pandemic to ensure that those people currently in inpatient provision will not suffer additional isolation and further breaches of their human rights as a consequence of restrictions that might be put in place?
The Honourable Lady makes an important point, which is that throughout this challenge we as a country face, we must ensure that everyone is treated with dignity and receives the care and support that they deserve. I know that, I know that my right honourable friend, the Secretary of State, will have heard what she said. Given he's in Cobra, he might not, but I will ensure he has, and will mention that to him. She may wish to specifically raise that in the context of future tranches of guidance that will be coming forward in future days. She may want to raise that with him specifically later. Mr. Deputy Speaker, modern buildings, more staff, an NHS that continues to truly serve its patients. A national response to coronavirus, that is what this budget delivers. We can tackle this emergency while putting in place the long-term improvements that NHS clinicians are asking us for. We can fight the war against coronavirus as a united country, but we can also build the peace. We will stop at nothing to protect life and to protect and invest in our NHS. And, Mr Deputy Speaker, I commend this budget to the House.
Order. Just to point out that the statement on coronavirus will now be coming at 6 p.m. Justin Madders.
Thank you, Mr Deputy Speaker, and can I first of all welcome the Minister back to his place after his period of self-isolation. And I'm sure that both sides of the House will agree that the current coronavirus crisis has demonstrated beyond all doubt just how important our public services are. We all know this is indeed a very serious time, that our constituents will be concerned, and I know many are actually frightened in the way the crisis has escalated over the last week or so. So can I start by sending our condolences to all those who have already lost a loved one, including sadly one gentleman in my own constituency. And can I also send our gratitude to those who are already working flat out to do their best to limit the impact of this, be they in the NHS, the rest of the public sector, as well as those in the private and voluntary sectors who are making a vital contribution as well. So as the Minister will know, we are supportive of the national effort to contain and delay the spread of the virus, and of course it would be irresponsible of us as an opposition to make any attempt to exploit this pandemic for party political gain, and I thank the Minister for his kind words in respect of that. But equally, it would be irresponsible of us to ignore the concerns being raised by the public, the scientific community and the sector more widely. It is critical that we ask important questions on their behalf, especially when the limits of public service are going to be tested like they have never been tested before. We know that many aspects of life will have to change or stop altogether, albeit temporarily. But it is to be hoped accountability, transparency and the ability of opposition parties to scrutinise government decisions will continue. We are under no illusions that at this time our ability to do that comes with a particular responsibility. So I hope the House will understand when today I say I will focus mainly on the challenges around the immediate crisis facing us and ask some of the many important issues that have been raised. And I appreciate there will be a statement later on, and I understand that the Minister will refer some of the responses to that, but we will have slightly more time, I think, in this debate to raise some of the important concerns that have been raised with us by many in the country. But let's start on the budget, as this is a financial debate. First of all, we have previously acknowledged the extra funding that was announced for the NHS and social care as part of the COVID-19 response in the budget. It's something that we have long called for. There remain no unanswered questions around how that funding will be precisely allocated. I wonder when the Minister responds if they can tell us exactly how the extra funding will be allocated and what will happen once that money is depleted. The NHS said last week that it needs to scale up intensive care beds 7-fold. That new pot of money is going to run out at some point and it will need topping up. Will another budget be necessary then? And what will the process be for determining resources at that point? So whilst we welcome the extra funding, we're all aware that this is in the context of the NHS already facing extreme pressure, as usually happens over a busy winter period. We know that in the last NHS winter report from 2 weeks ago that 80% of critical care beds are occupied and that 93% of general and acute beds were also occupied. We know the proportion of people being seen within 4 hours at A&E is on the lowest on record, and the target has not been met since July 2015, the best part of 5 years. We know the number of people on waiting lists in England is the highest it's ever been. Nearly 4.5 million people are on a waiting list for treatment, and the waiting list target has not been met for nearly 4 years now. And sadly, some cancer targets have not been met for over 6 years. Those figures should tell us, Mr Deputy Speaker, that the NHS is already stretched to capacity and that we are not starting from the optimum position. But it also tells us why the government's strategy of delay is one that has to be supported. Even if we take at face value the government's insistence that it's provided enough NHS resources to deliver the commitments to be found in a long-term plan, we must surely all accept that the COVID-19 outbreak will lead to an increased demand on trusts, which mean resources in the system will have to be reallocated. Should trusts now be expending time on resources on working out their control totals and end-of-year accounts at this precise moment? Will beds from the private sector be made available to COVID-19 patients and at what cost? What will the process be for trusts who have particularly large outbreaks and have increased demand? Is there any audit being undertaken of disused hospital or other public sector facilities that may be required at some point in the future? For example, is there any way that the brand new Royal Liverpool Hospital building could be brought onto stream more quickly? Is the government sourcing more ventilators, and when can we expect to see those available? Many manufacturers, of course, export all around the world. Will steps be taken to ensure that the NHS is at the front of the queue when those goods are produced? I'll say a few words on workforce, because we know that before we entered the crisis, the NHS was already short of over 100,000 staff, including 43,000 nurses and 10,000 doctors, and that the impact on staffing shortfalls manifests itself across the whole spectrum of NHS performance, as I've just outlined. It's therefore more critical than ever that those people who work in the NHS and whose goodwill we rely on already get adequate protection too. And it is evident that in order for patients to be able to have the best care possible, the NHS must support its staff to ensure they stay well and can provide that vital care. And that means, Mr Deputy Speaker, a continuous supply of the right equipment and facilities. PPE is vital in this respect. So I wonder when we hear the response, or perhaps in the statement later today, we can hear about what is being done to secure supplies of equipment and whether there is enough capacity in the system to ensure continued supply. We'd also be grateful if they could offer more information on the plans that have been mooted to get retired staff back into the health service. Will some of the money announced in the budget be used to deal with the anticipated increase in the wage bill that would mean? And can we also have an explanation as to how these people will be protected, given that, by definition, the majority of them are likely to be over 70? What oversight will be put in place to ensure they are delivering safe care if the revalidation process is to be suspended for retired returnees? Those on the front line I've spoken to are concerned about identifying the point at which an individual has been away from practice so long that it becomes impractical to reintegrate them in a safe and effective way. Will there be guidance issued on what this point might actually be? And what consideration has been given to those in the existing workforce who might be in a more vulnerable category because of their age or because of an underlying health condition? A major concern is that there is a lack of clarity on when people should be tested. We're hearing of many frontline NHS staff displaying symptoms but who are not being tested. What does that do for morale, if nothing else? The World Health Organization has said that we should be continuing to test and contact trace those who are suspected to have the virus, and it is a matter of importance that we have a full explanation as to exactly why we are currently diverting away from WHO advice. And it's been reported that labs are overwhelmed and tests are now taking several days to come back with results. Is the current ambiguity over testing policy a question of capacity rather than anything else? And will the government be putting more resources into those labs, and when will this materialise? It seems to us that continued testing is vital not only to stop the spread of the disease, but to also understand when its peak has been reached. It may also be the case that efficient and accurate testing means less people are having to self-isolate unnecessarily, which of course has an unnecessary economic knock-on effect. Certainly will.
Thank my honourable friend for giving way. A GP has been in touch with me today. They were in close proximity to a patient who's likely to have coronavirus, have been sent home to self-isolate and have not been tested. So how on earth will they know that when they do return to work, they're not a risk to others? Surely testing should be extended to vital GPs such as this.
I thank my honourable friend for his intervention. He makes the point I was making very well. It's, I think, evident that if that particular GP doesn't have the virus, it would be better for us all to know sooner rather than later so that they can get back in and treat patients. But it's also worth restating at this point that if you do have suspected symptoms, you should not be turning up at your GP practice. That is one of the ways that we will unfortunately spread the virus. I'll give way.
Thank you for allowing me to intervene. The case that we've outlined there is very important, but we also need to remember that the social care workers who will be visiting older people who need care in their home will also be placing their patients at high risk. And at the moment, there are no plans that I've heard that involve testing those social care workers, who should say, many of them, by the way, are just paid over the minimum wage. You know, there's a real question here about, we say that we value the NHS, we say that we value these community workers. I'm not sure a lot of them feel that way at the moment.
I thank my honourable friend for his intervention. I will be dealing with the concerns around the social care sector in a little while, but the points he makes are absolutely valid ones and certainly do need a government response. So, Mr Deputy Speaker, in terms of the NHS, we shouldn't just think about this in terms of protecting staff, in terms of doctors and nurses and other frontline staff, but we should also think about it in terms of the cleaners and the porters and all the other essential staff who are needed to keep a hospital running and actually who also play a vital part in infection control. And we often hear about the importance of data, and it does seem to me this is a particularly clear example of where data has a huge role to play. If the data is not collected on a regular and consistent basis, then surely we're not in the best position to take the right action. Yesterday it was announced that UK medical schools have been urged to fast-track final year students to help fight coronavirus. Can we have an explanation as to how this will work and how we will ensure that graduates still face a rigorous testing to ensure they can provide the best quality care for patients? There is certainly a role for them to play, I believe, but trusts need clarity on what the limits of that are so they can plan ahead. And also, are staff on maternity and paternity leave being encouraged to return to work early? And would they be able to do so without taking any, losing any untaken leave? Certainly will.
I wonder if he agreed with me also, a question I just asked to the Defence Ministers, that we should be calling into full-time reserve service, particularly members of the Royal Army Medical Corps and the Medical Corps and the other armed services, if they are not already, of course, NHS workers in their civilian lives. There are people there with excellent training, excellent skills, and their facilities should be brought into use as soon as possible.
I thank my honourable friend for his intervention. He makes a very, very important point, and I think it shows the spirit of this place at the moment, which is we're all coming up with very important suggestions, and I think no stone should be left unturned in us using all the resources that are disposable to tackle this virus. So, Mr Deputy Speaker, as we move into the later stages of the government's plan, will we expect to see a cancellation of elective surgery, which of course will only make those record waiting lists grow further? It wouldn't be a surprise to see that, I think it would be fair to say, but a reduction in elective surgery will have a knock-on impact on trust finances over the longer term. So I'd be grateful if we could have some clarity about what contingencies will be put in place to help trust financially in these difficult times, especially when they are collectively in deficit to the tune of almost £1 billion already. And is there also a case for those loan repayments that are currently made by Trust back to the Department to be actually deferred for a period of time? There was a great deal of surprise and disappointment when we saw no mention of public health in the budget last week. Directors of public health are preparing local responses to COVID-19 at this time and are having to actually expend significant sums of money in relation to this, yet they don't know what their public health allocation will be for the next financial year, which I need to remind the House starts in just over 2 weeks' time. I'm sure the government can see what an invidious position that is putting them in, so we urgently need those allocations to be published. Can we be told when this will happen, and can we be offered assurances that the funds will be sufficient to help local authorities deal with these issues? Has any assessment been made of the extra demands that have already been made on public health budgets in terms of preparatory work? And it's likely that the knock-on economic effect will severely impact council finances. There will be less people using services that they currently pay for example in leisure facilities. It's likely council tax collection rates will drop, and there will almost certainly be an unanticipated expenditure from covering for staff sickness. And that's before we get on to the issue of social care. So, I certainly will.
Is my honourable friend aware of whether the government is continuing to pursue the idea of herd immunity, namely letting the virus transmit almost unchecked through the population, which would obviously put overwhelming strain on beds, on social services or anything else? Or does he think they're basically trying to minimise the transmission through asking people to move and assemble less and to get resources in place and have the testing in place? Because it does seem to me, I'm worried that they're still attached to this social services model rather than the evidence-based experience from China and elsewhere of ways to control this virus.
I thank the honourable friend for his intervention. I think that's a perfect question to be putting to the Secretary of State, who will be here in a short period of time. But it does, I think, actually raise an important issue about the message that's been put across here. There are all sorts of stories that are coming out in the press, not all of them necessarily accurate, and I think it's really important that we do our utmost to make sure that we have a clear and consistent message across the board. And I'm not sure whether herd immunity is a government policy or not, but I'm sure that the Secretary of State, if he's so minded, will take the opportunity today to put that straight once and for all. Yeah.
I thank my humble friend for giving way. And on the issue of confusing messages coming from government, I wonder whether he can help me seek clarity over the advice on if people self-isolate, can they still go for walks outside? Can they still go outside and walk family pets if they go on their own? Or are they to be contained within their own property? Because there seems to be a mixed message about what constitutes self-isolation.
Thank my honourable friend for her intervention. Again, I think that's something that we need a definitive answer on from the Secretary of State. I appreciate that things are evolving very rapidly, and sometimes what was considered best practice a few weeks ago may change in the light of evidence, but I think it is incumbent on us to actually hear from the Secretary of State's direct mouth in here what the advice is, and then we can all send the same message out to our constituents so there is no more confusion and ambiguity.
My honourable friend was excellently covering the issue of council income, and there's an area that I am concerned about and I have heard nothing about, is council rents. Many council tenants are at risk of losing work or being forced into self-isolation and may not get paid, and we appreciate the work the government has done on statutory sick pay, but that won't be enough to pay council rents and indeed housing association rents either. And does my honourable friend share my concern that many people could be at risk of arrears unless the government can support councils in addressing this?
I thank my honourable friend for her question. She's absolutely right. There's a whole raft of issues that are going to have a knock-on effect over the coming months, and clearly whilst housing revenue accounts are separate to main council budgets, it's clear they still need to balance. But I mean, we've seen over the past decade, as a consequence of welfare reform, how councils and housing associations have adopted their policies to deal with the usual loss of income from a number of changes in the welfare benefit system. And I think that's a dialogue that we need to keep open over the next few months, but I think it would certainly be the case that we couldn't expect full collection rates at this particular time, but we need to work with people to understand exactly what the limitations of that can be, and we'll certainly talk to the government on that and in terms of legislation that comes forward in due course. One more? Yep.
You've been extremely generous with his interventions being allowed. To share my concern, though, that beyond rent, actually there are so many households that are just a payday away from poverty, that there will be people who will be sent into debt that they may never get out of in their adult life. The government surely need to do far more to help households who are really on the edge.
Okay, thank you for that intervention. I think that is a very fair point, and I think that we're only beginning to just understand just how precarious a lot of people's household incomes are in this economy, and I think it's going to take a concerted government effort to actually support people that stand, but it's also going to take all those people in the private sector who may have a debt with an individual to hold off enforcing that whilst this crisis comes through. So that again is something that we need to work on. I'm afraid I won't be able to take any more interventions, but I will, Mr Deputy Speaker, address the issue of social care, which has come up a couple of times in our exchanges already, because it's unfortunate that once again we've had a budget where social care hasn't been addressed. We know that local authorities have seen £8 billion cut from their social care budgets over the past decade, leaving people struggling without any care at all. The reality is that the social care system is already at breaking point, and it's likely that the spread of coronavirus will test our social care system even further. Without proper measures to protect people in care homes and those who receive care in their own homes, there could be tragic consequences, and it's crucial that social care receives the same attention from the department as the NHS does. So we would expect to see a plan to advise people in social care along the lines that we've discussed already. And as has already been mentioned by my honourable friend, the member for Cardiff South and Penarth, one of the particular concerns the social care sector has raised is the availability of personal protective equipment, which is crucial to protect staff and patients. And this equipment is just as necessary in the social care setting as it is in the NHS. And I've heard myself from local care companies about difficulties in sourcing hand sanitizer, to name but one example. As equipment runs low, how will care staff, including those who are actually self-employed, have the equipment they need to continue to keep patients safe? But the biggest concern for the social care sector is whether they will have the staff needed to deal with this crisis. As we know, across the sector there are already 122,000 vacancies, leaving staff feeling under immense pressure, and we know that they already feel that pressure to come into work when they feel unwell due to staff shortages. But in this case, it really is vitally important, if they do feel unwell, that they stay at home. But how will the government ensure there are enough staff to care for patients when we have far more people in the care sector unwell and self-isolating? And a quarter of social care staff and almost half of all home carers are on 0 hours contracts. For some care staff, there is no guarantee that they will be entitled to sick pay, despite what we've had as an announcement today. And that is particularly true of care staff who work for multiple agencies or work irregular hours. It is vital that those staff, as a key part of the workforce, feel fully supported if they become unwell. So what we need is a guarantee that all social care staff receive statutory sick pay. All workers need that reassurance from government if they're unable to work, that they will receive sick pay. And over the past few days, a number of nursing homes and care homes have made the difficult decision to close their doors to visitors. They've made this decision themselves in the absence of clear guidance, but families are now unable to see their loved ones, and they will want reassurance from the government that this is the safest call. So really, we want to know whether there will be guidance for the care sector on this particular issue. And it's inevitable that social care providers will face difficult choices over the next few months. Many will face higher costs, and we know last year more than half of social care providers handed contracts back to local authorities because of financial pressures. This causes immense pressures on councils and worries, of course, for the families of the people receiving the care, and it seems inevitable that we may face that situation again soon. So will local authorities and care providers get the financial support they need if cost pressures become too much to deliver safe care? At this difficult time, we need to ensure care services continue to provide the vital support that people need. And what about those who provide care outside the system for a loved one? There will inevitably be people who will no longer be able to provide care for a period of time, and the state has no official role to play in that situation, but those people will still need help and support, and how will that be addressed? So, Mr Deputy Speaker, in conclusion, providing well-resourced and well-funded public services is vital to tackle the spread of this disease, but of course that's not the whole picture. Every member of society is going to have to play their part. We're all going to have to recognise that the impact of this could be felt for many years to come, but we should also take heart that, as a country, we have a truly national health service and we have a capacity to rise to whatever challenges we face, so we are better positioned than many to take this challenge on. But that will only be true if we can be confident that services that people rely on in the coming months are robust enough to deal with the storms ahead. A decade of underfunding has not left us in a strong position as we would like, but it seems that in the hour of need that may change, and we will support the government in any attempts to boost funding across the board, but we will not be afraid to point out when we believe measures are not enough. And beyond funding, we want messages from the government about the action they are taking to be clear, consistent and quick. And we all have a responsibility in this place to get that message across, and Her Majesty's official opposition stands ready to give that message as well.
The 7-minute limit's not going to come in until after Peter Grant, but I know that the next speaker will bear in mind that this debate is really oversubscribed. David Mundell.
Mr Deputy Speaker, and I'm pleased to have an opportunity to speak in this debate. Harold Wilson said that a week was a long time in politics, and during Brexit we found out that it was an even shorter time, but the budget does only last Thursday seem like a lifetime ago. I, sitting listening to the Chancellor, even then still harboured hopes of a long-planned personal visit to New York this weekend, but that is simply not able to happen for all the reasons that we see around us. And 3 weeks ago I was in Rome for the Scotland-Italy rugby match, and at that point the talk was of difficulties in the north, but no one envisaged that instead of the crowds in St Peter's Square or outside the Colosseum, there would be nobody. Now, I'm often asked as a Member of Parliament, what is the most difficult issue and time that you've had to deal with? And for me, the answer is very straightforward. It was the foot-and-mouth crisis of 2011, and one which deeply affected my constituency. And whilst I want to be very clear, I'm not making any comparison between that disease and coronavirus. The comparison is between the impact of an event of that scale, and particularly how it impacts on businesses and their continued prosperity, the wider community, and also, as a report subsequently from Strathclyde University and others identified, the impact of isolation. Because during that period, many farmers had to be isolated on their own properties and could not leave other than if very stringent measures were taken at that time. And what that report 2 years later made very clear was that there were long-term consequences from isolation. And I think that that is something that we do need to take on board and think about and learn those lessons and others where those events have occurred as we go forward with measures that might come into place. And I'm sure those will be issues that will be debated when we have more focused, the statement and more focused debates on coronavirus. And as we've seen and are seeing, firstly, those people who were most, as businesses, affected by those circumstances were the self-employed and contractors. And they're a group of people who we just need to give the maximum possible support as we go forward. But also, we saw the hospitality industry very, very badly affected. And some of the lessons that came from that, in my experience, was, for example, that for small businesses, what they wanted, what they needed, were grants, not loans. I remember taking part in a demonstration. I know that will surprise you, Mr Deputy Speaker, but outside the offices of Scottish Enterprise, Dumfries and Galloway, with colleagues and small businesses, to make that point, that it was grants, not loans, that were needed to see them through. Of course, rates relief is to be welcomed, and I welcome the package of measures that the Scottish Government has announced, but that is capped, and I think we do need, again, to look at whether that cap is appropriate. Then, of course, the other big players are the banks. Now, from my perspective, one thing that will make dealing with the situation we face a little bit easier is that it is across the whole of the United Kingdom, so that it is not banks who are based out with the then south of Scotland who are being asked to support businesses and not really understanding what is happening on the ground. But we do need that unity of purpose from the banks. And everybody, I think, in this place who've had experience of dealing with the banks know that they do operate on a basis of always saying the right things, but doing them is something else, and especially when the computer says no. So we need to make sure that the banks follow through on the commitments that they've given and on the positive tone that the Chancellor set in the budget. And then we need a uniformity of approach from government, and that's all levels of government. That's our UK government, it's the Scottish government, it's local government. And the underlying philosophy from all of those institutions has to be that we want to keep our businesses going. We're not jobsworths wanting the returns in on the exact dates. And that's why, again, I welcome what the Chancellor had to say in relation to VAT holidays, into flexibility with HMRC. But again, I'm sure members across the House have all experiences of the HMRC not being particularly flexible, and we just need to see that again followed through, because that unity of purpose from government is going to be vitally important. And as has already been raised in an intervention, it is the hospitality and tourism industry in a constituency like my own that's most vulnerable. And often, again, as I found out during the foot and mouth crisis, it's businesses that have done well, that are planning for the future, that are often the worst hit. So, for example, the Gretna blacksmith shop in my constituencies, which was one of the most visited tourist attractions in Scotland, has won numerous awards for their attempts to attract Chinese visitors. They have some of the highest number of Chinese visitors coming to that location, but not anymore. There are none. And therefore, their business model has been very, very seriously disrupted already by these events. They're a bigger business, not a small business, but they need help and support too if that sector of the economy is to continue to survive after these events. Hotels in my constituency are already in difficulty, and many, such as the Moffat House Hotel, have closed. One local hotelier told me that they were, as they saw it, facing a perfect storm of events, of which the coronavirus wasn't at that stage one. But that is one issue on which I would make a direct appeal to the Scottish Government, because our system of business rates in Scotland is still not right in the way that it supports and helps the hospitality industry, and particularly hotels. As I indicated, I think that there are a lot of lessons to learn. I hope that there's still the institutional knowledge in the Scottish Parliament, the Scottish Government, to learn lessons from 2001, and that also that this Government can take some of those on board, particularly in the point I made earlier in relation to isolation. Now, in relation to the budget as a whole for Scotland, I welcomed the budget, in particular the £640 million of additional funding for Scotland, which was £172 million more than the Scottish Government had themselves anticipated. So by any analysis, the Scottish Government got extra money. Now, in my experience, the Scottish Government hasn't always welcomed or even acknowledged extra money, and indeed in the past sometimes it's been the wrong kind of money, even if it was acknowledged. But I hope that on this occasion and in these circumstances they will acknowledge it. I'm pleased, as I said before, with what they've had to say in relation to spending on business support and coronavirus, but I would like to see the money that's come forward being spent also on infrastructure. When the Scottish National Party were not in power, and when they back in the 90s held the constituency of Galloway and Upper Nithsdale, as it then was, both the A75 and A76 were described as the most important roads in Scotland, forgotten roads that needed to be substantially upgraded. Of course, in the period since 2007, in which the Scottish Government has been essentially SNP or SNP minority, that investment has not been forthcoming. So I use this occasion again to make a plea for the needs of the A75 and A76. I'm sure there's somebody in the SNP who remembers those previously given commitments. Now, obviously, coronavirus is significantly impacting on today's debate, and rightly so, because it's the issue that most impacts on our constituents at this very moment. But I do want to also highlight one other issue on which I had written, along with 15 Conservative colleagues, along with the Association of Convenience Stores and the British Retail Consortium, to the Chancellor ahead of the budget, and that is the issue of access to cash. Now, access to cash is a big issue in a crisis. Many people when they feel themselves in a position of crisis, do like just to have some cash available to them so that they can have a flexibility in how they approach difficult circumstances. But there is, Mr Deputy Speaker, a crisis in our country in access to cash. It affects large rural constituencies like my own in particular, but it also affects many other communities, and some of the most deprived communities in our country are those who bear the hardest impact, because I hadn't realised until relatively recently that the average withdrawal from a cash machine is around £10 or £20. And if you're paying a fee of up to £3 on taking £10 out of a cash machine, that is a very, very significant, very significant markup. We've also seen a report which indicated that about 8 million people in our country are not ready, not able to cope at this time with a cashless society. Now, a cashless society may come, and indeed the irony I often find when I travel from my constituency to here in central London is that central London is in many ways a cashless society, but also with hundreds of cash machines available as well. So we need to do something about this, and I welcome the fact that the Chancellor did in his statement promise to take action to legislate to secure the long-term future of cash. But it's very important that the steps he takes are the right steps, and I'm pleased to see that the Minister's nodding, and I hope they'll nod in agreement that those steps include reversing the arbitrary cuts to link interchange rates paid by banks to fund the network, exempt free-to-use ATMs from business rates, and recognise that ATMs are the only infrastructure through which to guarantee national access to cash. Of course, cashback at convenience stores and other places has a role to play, but it's very, very important that we have a sustainably funded network of cash machines throughout the country, and by that I mean the whole country, after we've seen so many, particularly in Scotland with the Royal Bank, so many branch closures affecting our constituents. To conclude, Mr Deputy Speaker, I agree with the honourable gentleman from Ellesmere Port and Neston. Just like the foot-and-mouth crisis that afflicted much of the south of Scotland 20 years ago, the consequences of these events go on for years. They don't just end when somebody declares that the crisis is over. They go on for a long, long time for the businesses, for the individuals and communities that have been affected. And we don't just pledge support to those individuals and communities today. We want to pledge that support to see them right through the consequences of these events. I think that will mean revisiting some of what was announced in the budget and some of which was announced by the Scottish Government, and if that is necessary, then so be it.
Honourable Member for Dumfries, Clydesdale and Tweeddale for his contribution. I thank him for the measured tone in which he delivered his comments. It's noticeable the last few days that things have been a bit more calm and sensible, even when we've disagreed politically in here, and maybe that's something we could keep going after the healthcare crisis or the public health crisis has passed. I noted that the right honourable gentleman couldn't resist having a wee dig at the SNP government for not having done up his bit of Trunk Road yet. Now, obviously, I can't speak for the Scottish Government. The Scottish Government's pending decisions at the side of the Scottish Parliament. But I have had a quick look at the Scottish Parliament website, and I do have contact details for the MSP for Dumfriesshire that I can pass on to the honourable gentleman afterwards. Some chap by the name of Oliver Mundell, who he might find is quite amenable to being lobbied. I don't know if he's still holding surgeries, but you can probably find his phone number for him. Mr Deputy Speaker, I'm pleased to be able to lead from the front bench on behalf of the SNP group in today's debate. Now, clearly our position in this debate is a bit different from a lot of other parties, because a lot of the detailed discussions that are going on about what health trusts get funding, what local authorities get funding, we will keep out of, because we have a devolved national parliament to take those decisions on our behalf. And while today's debate is about the funding of public services, as the previous three speakers have made clear, we can't ignore the rapidly changing public health challenge that faces all four nations in the United Kingdom, and indeed the majority of nations now in the world. And although the Secretary of State's statement later on will be the correct place for detailed questioning about the Government's approach to the health challenges, I want to look at some of the significant and even potentially fundamental changes that the economy is going to undergo as a result of this. The Right Honourable Gentleman, the former Secretary of State for Scotland, commented on the permanent change that the foot-and-mouth outbreak of 20 years ago made to the economy of rural Scotland. This is much bigger. Its impact on the economy throughout these islands is going to be much bigger and will probably be permanent. My honourable friends that spoke in last week's debate will have set out which of the Government's emergencies actions we fully support, and there's a lot of them that we can fully support. There's some where we would like to see more being done. There's a few where we think the action is simply going in the wrong direction. But I hope that at all times the discussion on those matters can be kept as civilised and as temperate as it has been over the last few days. But what I want to touch on briefly to begin with is the fact that the situation has changed significantly since my colleagues made those contributions on Wednesday and Thursday last week. It's changed significantly since the Chancellor made his budget speech. It's vitally important that the Government's response is not only sufficiently robust but also sufficiently flexible to respond to those changes. And I'm encouraged by the degree of cooperation we've seen between the governments of the UK through COBRA, for example, in agreeing what our combined and shared response to the public health issues will be. I hope we can see a similar degree of proper engagement when we look at how to deal with the economic challenges, because it has to be said that in the past the UK Government hasn't always engaged positively and constructively with the devolved nations on those matters. To give just one apparently small example as to how the coronavirus outbreak is already affecting my Glenrothes and Centre 5 constituency. Like a lot of places, a lot of constituencies, maybe most constituencies, we are blessed with a huge number of brilliant wee independently owned cafes and restaurants. Now, restaurants sounds quite grand. I'm talking about places that can hold 20 or 30 people at most for a plate of soup and a bacon roll for lunch. Collectively, they contribute not just economically but socially. The contribution to my communities and to all of our communities would be impossible to measure. Some of them have changed hands recently or have been established for less than a year. Some have been on the go for decades. Now, I'm clearly not privy to any of their individual financial affairs, but I doubt if any of these businesses would survive 2, 3, 4 months without any customers. And if we believe that some people are interpreting government advice to be that's what these businesses would have to put up with. Now, clearly it's not going to be as bad as that, but that's an indication of the fact that these small businesses are going to need some very severe intervention from the government, and some of them are going to need it very, very soon indeed. I'm happy to support them as much as I can. Yeah.
I thank my honourable friend for giving way. There are various examples of this happening. The Hug and Pint, which is a fantastic little venue on Great Western Road in Glasgow North, has had to announce that it's going to close from tomorrow, but has set up a fundraising, a crowdfunder campaign, as have various initiatives, the folk music scene, for example, in Scotland. And does he commend these initiatives to try to encourage? People would, in other circumstances, have been going there for a pint anyway, so perhaps they can spare that cost to help some of these businesses, small businesses, through the most difficult period.
I think the honourable friend makes a very valid point. Sometimes an indication as to how important a lot of these businesses are in their local communities. The neighbours don't just see it as a business, and they will support them. The difficulty is that if the neighbours and the customers and the clients lose their jobs and suddenly find that they're having to get by on a wholly inadequate social security system, they won't be able to afford to put £4 or £5 over the bar in the local community-owned pub, whether or not they get a couple of pints in response to it. So while I support a lot of these businesses as best I can, and some of them are very, very cooperative for me holding advice surgeries, for example, but if I do what a lot of my colleagues are doing and start to cancel surgeries, if I don't go to the local coffee shop and sit for an hour or so talking to people, nobody else will. So by taking that decision, I can understand why people want me to take it. I might well be hastening the time when so many of these valuable businesses are no longer able to continue. And if they shut down temporarily just now, some of them will not reopen. And it's not just cafes and catering and hospitality businesses. The same goes for locally owned hairdressers, bakers, craft shops, 1 or 2 person printers and so much more. Small independent retail businesses, small individually, but cumulatively they represent the financial well-being of a vast, vast number of people on these islands, many of whom stand to lose not just their jobs and their livelihoods, but the very homes they live in. Because for a lot of these establishments, and I'm thinking especially of the small bed and breakfast and guest house businesses, the business is their house. A lot of others have mortgaged their houses to finance the business. They literally stand to lose everything apart from the clothes they're stood up in if things go wrong, and they are going to need help quickly. So while I obviously welcome the emergency measures that the Chancellor announced last week, I don't think they go far enough, and I have a fear that a great many small and very valued businesses in my constituency and in all of our constituencies will close and will never reopen. At the other end of the scale, we've seen severe warnings from some of the biggest and most iconic transport operators in the UK and elsewhere, with BA, for example, warning that even their survival isn't guaranteed if they get it wrong. This morning, my journey to Edinburgh was the quietest I can ever remember driving to the airport in 5 years as an MP. I don't come down in the train all the time, but of the time I've come down, the car park where I usually struggle to find a parking space was deserted. You could have played five-a-side football without bumping into a car. The flight that I quite often struggle to get a seat on, I would guess was 30% full. That's not sustainable. And if I had done what I prefer to do when it's realistic and come down in the train, the drop in business, I don't know if it's as big, but it is there, and the train operators are struggling as well. Hotel bookings in London and many other places have crashed. If you look at the prices on hotel websites now compared to what they were 3 or 4 weeks ago, they're half price, quarter price, or less than that. These businesses can't survive at that. And again, there are tens of thousands, perhaps hundreds of thousands of jobs at stake. It's not about bailing out some of the billionaires who own these high-profile businesses. It's about protecting the rights of tens of thousands of workers whose livelihoods are on the line. And despite the torrent of platitudes from the government, and despite some of the welcome measures that were announced last week, most of these hundreds of thousands of people face being thrown at the mercy of a social security system that was utterly unfit for purpose before and will be even more unfit to deal with the challenges that it's now about to face. So while the changes that have been announced so far are welcome, we need a lot more, and we're going to need it an awful lot quicker. Now, I know that there will be detailed spending plans for government departments published later, but there's already worrying indications that the budget is stretching the public finances to their absolute limit. In page 5 of the Office for Budget Responsibility report, public sector net debt is likely to increase by 125 billion in 4 years' time. And that's even, as I pointed out earlier on, that's assuming that 20% of the promised capital spend doesn't happen. We can't rely on economic growth to make that debt less painful to repay in 5 or 10 years' time than it would be just now, because Brexit's going to slow our economic growth by at least 4%, even if we get a good deal. The OBR have commented that public finances are more vulnerable to adverse inflation and interstate rate surprises now than they were before. It strikes me that the fundamental problem with the Blair-Brown government was that effectively we had a Chancellor with his checker who by instincts was a Keynesian, and he tried to do Thatcherite economics and it failed. Now we've got a government that is packed full of Thatcherites. They're having a wee shot at Keynesianism, and I don't think that's going to work either. The OBR also warned us, as I know some of my honourable friends have highlighted previously, that all of their forecasts assume an orderly move to a new trading arrangement, first of all with the European Union and then with the rest of the world. Mr Deputy Speaker, while the minds of the UK Government and of all our current and potential trading partners are quite understandably fully occupied by COVID-19 and will be until after the June 2020 deadline that the Government has said it needs to at least have the basics of a trade agreement in place, surely the Government will now finally admit that enshrining the end of the transition period of December 2020 into law was an act of criminal recklessness. They might not have known what crisis was going to happen in the intervening period, but it didn't take a genius to work out that something might have gone wrong. So while the government announcements and public spending have been welcomed in many quarters, and rightly so, when we look at the hard facts behind those announcements, we find that the long-term sustainability of our public services is, if anything, less secure after this budget than it was before. That's not helped by an illogical and immoral approach to immigration, which is going to contribute to a 0.3% drop in GDP over 4 years. And ludicrously, that immigration or anti-immigration policy takes more money out of the public purse, because even the lower paid migrant workers, the ones the Secretary of State for Scotland, for example, that's the current one, not the previous one, that the Secretary of State for Scotland is so shamefully contemptuous of last week, accusing them of coming here to work on low wages just to take advantage of our benefits and our services. Even those low paid migrant workers pay 3 times as much in taxes as they take in benefits. So by deliberately stopping them from coming here, by deliberately stopping them from earning and paying their taxes, the UK government are deliberately creating an additional black hole of £1 to £1.5 billion in our public finances. Today I heard the head of Scottish Care, who represents Scotland's private sector care providers, and yes, I have issues about some of the private care providers in Scotland. But he was saying how moved he'd been that so many workers in that sector are offering to move away from their families to actually become residents in care homes or hospitals for a period of several weeks, just to make sure the people they care for don't lose out if several of the staff have to phone in sick. These are the self-same workers that this government regards as a burden on our public services. And as for the idea that hard-working, low-paid NHS workers should have to pay an extra flat-rate tax of £624 a head just for the privilege of continuing to work in our NHS, I can't describe that in language that you would allow, Mr Deputy Speaker, because there is no parliamentary language that is robust enough to properly describe the sheer immorality of that proposal. Now, the government will want to make a big noise about the new capital spending they've announced. As I said before, we'll see when it actually happens. But we also need to remember the very low baseline that it's starting from. The National Education Union, for example, has pointed out that in England there are 3,731 schools that need immediate repair. A further 9,972 are going to need significant work within 2 years at most. But the Treasury's own figures in the Red Book show that the Department for Education's capital budget next year will be £100 million less than it is this year. How's that going to help? In contrast, the Scottish Government has replaced or substantially upgraded 928 schools since SNP came to power, and I'm delighted that 2/3 of all pupils attending a secondary school in my constituency are in schools that are less than 7 years old. In Scotland, we've seen teacher numbers increasing for the 4th year in a row. In Scotland, while I can hear muttering, as always, from the usual suspects on the Tory benches, in Scotland there are 7,485 teachers per 100,000 pupils. In England, the equivalent figure is 5,545. I want to finish by looking at what the government's priorities appear to be. Working age benefits going up by 1.7%. If that was 1.7% on top of a similar increase every year for the last 5 or 6 years, that wouldn't be too bad. It's 1.7% on top of nothing for far too long. How can we defend a 1.7% increase in working age benefits when MPs are getting 3%? I won't defend that to my constituents, and I defy anyone in here to try to defy it, to try to defend it to theirs. So perhaps one of the emergency steps that the government needs to take is temporarily put Parliament back in charge of MPs' pay rises and have this place unanimously agree that we're not taking a pay rise this year unless it's going to be at least matched by the lowest paid workers within our society. The new financial year starts in 16 days' time. The Scottish Government have, if they're lucky, perhaps only just had confirmation of the full ban that consequential of this budget. I'm not convinced they've even got that yet. When we look at the potential impacts on the devolved finances of the COVID emergency, for example, we tried to disentangle what additional funding is coming to the Scottish Government, what additional funding isn't additional at all, it's already been announced, it becomes quite difficult. And I would suggest to the Minister that it indicates that the current financial settlement, the fiscal settlement between the UK Government and the devolved governments needs to be completely revised, because it simply doesn't give the Scottish Government the flexibility that it needs to respond to this crisis in the same way as the UK Government needs to be able to respond. I saw a comment recently that pointed out that it's sad that it's taken a public emergency, a public crisis, to force the government to do some of the things it should have been doing previously. And that even now, in responding to a public crisis, the government haven't acknowledged the many millions, tens of millions of private crises that have been going on in these islands for the last several years of this government's administration. There are still far too many people living in poverty. That number will increase significantly as a result of the coronavirus crisis. It is absolutely essential that the government looks to its spending plans, looks to its taxation plans, initially to make sure that as many as possible of those whose domestic finances are severely disrupted by this crisis are back financially on their feet as soon as possible. And then they have to acknowledge that we're starting from a position where far too many people on these islands are living either in poverty or so close to poverty that for that to happen in what is the 5th, 6th or 7th biggest economy in the world, depending on who you believe, that is utterly shameful. That for any government to be presiding over those levels of poverty 10 years after coming into office is something that they cannot be proud about.
Here. 7-minute limit. Greg Clark.
Thank you very much indeed, Mr Deputy Speaker. I'm glad to be called to speak in this budget debate, and it's good to see my honourable friend in good health on the front bench. I'd like, in the brief time that we have, to highlight 3 things in the context of the budget that we'll need to follow in the weeks ahead. Something about the science of the coronavirus, science and technology policy generally, and the future of retaining skills and jobs at this time. On corona, it's essential that our policy and practice throughout this crisis should be based on the science. We are fortunate in this country that we have in Professor Whitty as Chief Medical Officer and Sir Patrick Vallance as Chief Scientist, 2 people of learning, authority and integrity with direct personal experience of the management of epidemics. It is crucial that their advice continues to be followed in the way that it has to date. I'd like to raise 2 particular issues on this. And one is that the foundation of our scientific excellence is one of constant and unimpeded challenge. The peer review system that we have and the replicability of empirical research demand that. So it's very important in the days and weeks ahead that we don't see as disrespectful or distracting for the scientific community to question the basis of actions and advice. It is absolutely essential. It's how science moves forward, and it is the foundation of the excellence that we enjoy in this country. So we need to avoid, in this House and in external commentary, to treat any difference of opinion or challenge as being in some way calamitous. It's the way that we get to the right answer. I think it would help if the government would publish the membership of the Scientific Advisory Group for Emergencies, who have a particular duty to scrutinise and test the evidence. That would be important to know. And also to know when the government intends to publish the evidence on which the decisions that have been taken will be available. I know it's going to be published. It would be helpful to know when. The second challenge is this is clearly a dynamic situation, as all epidemics are. And it's essential that advice and practice can and does adjust according to the real-time findings of research on the outbreak, what works and what doesn't. And that must not, in the conventional political way, be derided as U-turns, but as the normal progress of scientific inquiry. And given the intense and absolutely understandable public interest, we do need to have constant explanations of changes when they take place. A number of members have mentioned the policy on testing. For the last few weeks, this House has been told about the expansion in testing capability. It will be important to understand the reason for the change in emphasis of the policy, and I hope that the Minister or his colleagues might be able to provide that to the House. My Select Committee, along with the Health and Social Care Committee, will play a responsible role in backing 100% this scientific approach, while playing its part in ensuring that Parliament understands the reasons for the steps being taken. Now, were it not for the entirely appropriate attention being paid to the coronavirus over the past week, more attention would no doubt have been drawn to what is clearly an extraordinarily positive budget for science and research. Just over 2 years ago, when I was the Secretary of State at Bayes, we published the White Paper on Industrial Strategy. And one of the key commitments made was that the UK should build on its strengths in an uncertain world, one of the key powerhouses around the world in innovation and science, one of our principal assets. And yet, despite that leadership, we were devoting less than 1.7% of national income to research and development. In the industrial strategy, we made a commitment to raise that to 2.4% by 2027, the OECD average, and beyond that to 3% thereafter. And the publicly funded research budget increased by a third, from £9.5 billion to £12.5 billion in 21-22, the biggest ever in history. Now, I remember the battles with the Treasury before my honourable friend's time there, and the struggle it was to achieve that commitment. So I think it is a momentous achievement to have not only reiterated that commitment to 2.4%, but to increase the funding available, not to the 12.5 billion that I was able to secure, but massively to 22 billion by 2024-5. And that includes a commitment to private investment through an increase in the R&D tax credit. There is much to be welcomed in this. My committee will scrutinise the prospective use of these funds, but it is warmly to be welcomed. It's important to emphasise that our excellence is not just confined to science and technology. We're renowned internationally for our creativity in the arts and humanities, and social sciences are an important source of innovation and growth. And I commend in particular the work that Sir Peter Bazalgette led in boosting the contribution of culture in our regional towns and cities through creative cultures, the programme of creative clusters, a programme which I strongly back. Finally, Mr Deputy Speaker, a brief word about jobs and the continuity of employment. During the present crisis, we've heard of the challenges of the hospitality industry. I would draw attention to the Earl Grey tea rooms in Southborough, in my constituency, who have faced a problem that's been described across this House, that the coronavirus is not one of the conditions that is included in their business continuity insurance. That needs to be addressed very urgently by the government to provide that reassurance to businesses right now. There's no time to be lost. It also applies to manufacturing industry, in which skills that are absolutely crucial for the continued expansion and flourishing of that industry could be lost if there is a problem with the disruption of supply chains that means that, for example, components are not available. So I hope that the government will look very carefully at what is being done in other countries to jointly with industry finance part-time working so that skills can be retained in industries including manufacturing and beyond, so that when this crisis passes, as I hope it will soon, these businesses can continue to make the progress that they've made based on the excellent skills that have been acquired.
Mr Deputy Speaker, a dark cloud is descending upon our world, threatening the lives and livelihoods of millions throughout the globe. We've only got to see what's happening in Italy to recognise just what could be to come in our own country. The health service, the police service, social care, already stretched by 10 years of austerity, are stretched yet further. In terms of what we do, however, at the next stages, now is not the time to panic on the one hand, and on the other hand, now is not the time to engage in politics as usual. There needs to be a unity of purpose across this House, and in particular on two key objectives. First, of course, to protect our people, and in particular the elderly and the vulnerable. But secondly is to minimise the impact on our economy, ensuring therefore that nationally and internationally a global recession does not happen, indeed potentially becoming a global depression. Now, the Chancellor last week said that manufacturing was going through a tough period, the economy. That may prove to be an understatement. We were facing a tough period before the advent of the virus. According to the ONS, we came into 2020 with a flatlining economy and, I quote, yet another decline in manufacturing, particularly the drinks, car and machinery industries. And that's why, quite rightly, Make UK, the old Engineering Employers Federation, called back yesterday for government to step in to limit coronavirus damage, to prevent further drastic decline in manufacturing and large-scale job losses. Now, I welcome a series of positive messages contained in the budget. Of that, there is absolutely no doubt. Crucially, however, going forward at the next stages, the government needs to do more. So, whilst it was welcome that there were some measures in the budget relating to the automotive industry, assisting in terms of the environmental transformation of the industry, the move to electric cars, the next stages, it is important that we see significant moves, the kind of which the SMMT have called for in terms of tax-free electric vehicles, £5,000 off VAT on vehicles alone, which would greatly boost the production of and sale of electric vehicles. And I argue that based upon my own experience, because when I was Deputy General Secretary of the old Transport and General Workers Union, and then we became Unite, back in 2008 with the global crash, I was, together with Tony Woodley, involved in negotiations with the then Labour government around emergency measures, one of which was the scrappage scheme. And as a consequence of the scrappage scheme, 400,000 cars were built. That avoided what would have otherwise have been catastrophe in the automotive industry. Indeed, in the first 6 months after the scheme was introduced, notwithstanding that what was happening in the global and domestic economy, there was an increase in registration of new cars of 31%. Had it not been for the scrappage scheme, we would have seen closures of car plants. I was involved then, together with the Honourable Member for Wentworth and Durham, in the negotiation of the Kickstart programme. And the Kickstart programme saw 115,000 homes built, 110,000 jobs safeguarded, and thousands of small and medium businesses that would otherwise have gone to the wall were saved. Now, those big measures were absolutely critical at the time, and the government needs to think big going forward at the next stages. And what's crucial is that the government brings together the voice of the world of work, the employers on the one hand and the trade unions on the other, around key next stage objectives, and following on from the excellent speech by the Right Honourable Member for Tunbridge Wells in relation to short-term working. This has been called for by the SMMT, by ADS, by Unite, by the TUC, by the G&B, employers, organisations and unions coming together to argue that such arrangements have the capacity to protect the industrial capacity of British manufacturers. In particular, praying and aid the German model, used first in 2008, significantly expanded, followed by other countries like Japan, Belgium, France, Austria. The German scheme in 2008 created a fund to pay workers up to 60% of their foregone net wages if factory production is temporarily cut. The scheme allowed employers to cut temporarily production without cutting jobs, maintaining vital capacity, and was credited by the OECD as saving 500,000 jobs in German industry. Looking back then, unemployment held to 7.5% in Germany, a rise of just 0.2%, and therefore what they managed to do in Germany was to preserve the capacity to undertake at the next stages the rebuilding of the economy. Jobs saved, pay continued, experience employed in response to the experience and skills were retained. Now, a successful example of how this is being used in response to COVID-19 comes from Denmark, where the government has brought together unions and employers' associations and agreed a deal for impacted industries whereby the state pays 75% of workers' wages and employers 25%. Workers give up 5 days of paid holiday, and in exchange there are no layoffs. And in the words of the Prime Minister of Denmark, if there's a big drop in activity and production is halted, we understand the need to send home employees, but we ask you, don't fire them. And Mr. Deputy Speaker, only this afternoon, I can't name the name of the company, but a major employer in my own constituency, where they've invested massively in increasing their capacity, desperately need short-term measures to preserve that capacity going forward if they're able to rebuild after the immediate challenges posed to the economy. So if I can just say this in conclusion, that whilst in the budget there are measures that are welcome, at the next stages the government needs to be more ambitious, working with the world of work, because there's no question of it. The threat that is posed is enormous and real, not just to life and limb, but also to our economy and our ability to recover. What we do now will determine whether or not we have recession or depression. The role of government is absolutely key in that process, working together with the world of work, and I would urge that the government rises to that challenge.
Order. We've got three maidens on the government side now, so the usual conventions apply, and whilst we can be flexible when the time limit hits 0, it is not elastic. Maiden speech, Antony Higginbotham.
Mr. Deputy Speaker, thank you for giving me this opportunity to deliver my maiden speech during this debate, and it is good to see you sat in the chair as I do so. There have been a number of eloquent and thoughtful contributions during the debate so far, and I hope I don't change that too much. On the 12th of December, I made history in Burnley by being the first Conservative to be elected since 1910. 109 years since the last. I want to first thank the people of Burnley, Padiham, Hapton, Westhorn and Cliviger for putting their trust in me and sending me down to this place. It is a huge honour. I also want to pay tribute to my predecessor, Julie Cooper. Julie was a committed local politician, having served as leader of the council before taking up her seat here. And she was also committed to something else, which I hope to carry on, that being the ending of hospital car parking charges. On this, she campaigned vigorously, and I look forward to working with the government to make that a reality, as we committed to doing it in our manifesto and as the Minister spoke of earlier. Mr. Deputy Speaker, my constituency of Burnley has existed in various forms since 1868. It encompasses not only the urban centre of Burnley, which is the beating heart of the constituency, famous for a Premier League football club, and Burnley Miners, where the House will be delighted to know that more Benedictine is consumed than anywhere else in Britain. But also the town of Padiham, which has its own distinct feel and community spirit, which has never been more important than in 2015, when the town suffered from severe flooding. And then you get to the rolling green fields of the villages of Hapton, Westhorn and Cliviger. Here we have a thriving rural economy. I've heard many colleagues speak of how their constituency is the best in this country, but I am confident that once you have all visited this gem of East Lancashire, you will agree that it is Burnley that takes that glorious title. Burnley is not a place of once was, but a place of what will be. It has some of the most entrepreneurial people in the country, with over 425 businesses starting up just last year. A college with a centre of engineering excellence, an Oscar-winning sound company, but above all else, it has a community that works hard every day, not just for themselves, but for each other. When it came to writing this maiden speech, Mr. Deputy Speaker, I asked the House of Commons Library if they could provide me with copies of those given by my predecessor, which they duly did. The only problem was they only went back to 1918, which is 8 years after the last Conservative was elected in Burnley. But I was not deterred. I went on and did my own research. Gerald Arbuthnot was elected to this place in January 1910, the second Conservative for the seat. And whilst I couldn't find his maiden speech, I did find many of his other contributions. And the topics of those contributions may sound familiar to us here today. Improvements to the railways, furthering trade with other countries, and reducing crime. So whilst the world may have moved on significantly over the last 100 years, the issues remain the same. Gerald Arbuthnot did not serve for very long as an MP, losing his seat at the second general election of 1910 in December of that year. Mr. Deputy Speaker, it is a fate I am hoping to avoid, and I say that as I look at the front bench. On leaving this place, Gerald Arbuthnot then sadly lost his life in the Battle of the Somme, but I was pleased to see that the Parliamentary War Memorial recently was updated to include its name, which has been missing for too long. And having looked back, I now want to look forward at what I hope to achieve for the people of Burnley as I sit here representing them. I've already spoken about the entrepreneurial spirit we have in Burnley, the businesses that currently power our town, from Saffron to Burnley Football Club, along with new ones sprouting up all the time. In coming here, I want to do my bit to make their life easier, encouraging even more to set up. Drawing on the engineering prowess of the town, the digital skills we are growing by the day, and the fortitude of those who live there. The UK is consistently ranked as one of the best places in the world to start a business, Mr. Speaker, and my job is to make sure that Burnley is the best place in the UK to do so. And I also want to work with those who are already in Burnley, supporting them as they capitalise on the free trade agreements this government is negotiating, not just with our European allies, which is vitally important, but around the world. And as a member of the Future Relationship with the European Union Committee, the government should know that I plan on scrutinising their efforts to do exactly that, making sure that in delivering a free trade agreement with the EU, we also deliver on our promises to the British public. And Mr Deputy Speaker, I am incredibly proud that this budget delivered by my right honourable friend the Chancellor last Wednesday shows that we are still the party of enterprise. It provides the support businesses in Burnley need to invest in new technology, to undertake the research and development that will keep us cutting edge, and employ the people who will power innovations of the future. That is because we know on these benches that the way you improve life chances, the way you reduce inequality, is by getting business booming. But it also relies on equipping our young people with the skills they need for the future. As I said on the campaign trail, one of my aims as the Member of Parliament for Burnley is ensuring that when our young people leave school or college, they have the digital skills they need for the 21st century, not the 20th century. My right honourable friend, the Education Secretary, can therefore look forward to me being a constant voice on this topic. As I wrote in my weekly column in the local newspaper last week, sitting here as the budget was announced, I felt incredibly proud to be the Member of Parliament for Burnley. It deals first and foremost with the significant challenge we as a country and the world face as a result of COVID-19. It is right that at this time we all commit to providing the NHS with whatever resources it needs to tackle the disease and protect life. The cross-party consensus on that shows that when it is needed, this place can come together and do what is necessary. And I hope that will continue in the weeks and months ahead. But the budget also delivers for our other public services. The extra funding for our schools, increase in per pupil amounts will make a real difference to the lives of children across Burnley, ensuring that your life chances are not shaped by circumstance, but by ability. The extra police funding will result not only in more officers on our streets, but also better equipment for those whose job it is to protect us. And extra investment in our infrastructure, because it is that infrastructure that gets us to work or university, transports our goods across the country, and gives us access to the digital world. Mr Deputy Speaker, it has been a pleasure to speak in this debate, particularly to give my maiden speech during it.
Chris Matheson.
Thank you, Mr Deputy Speaker. What a great pleasure it is to follow the maiden speech of the honourable gentleman, the member for Burnley, and I congratulate him on that. And he touched on the historical context of his predecessors and the tragedy of one of his predecessors losing his life at the Somme, but he also gave us a sense of the feeling of Burnley, that not only the urban area, but the area that stretches out onto the hills, not far indeed, Mr Deputy Speaker, from your constituency, if I may, up onto Cliviger, which is a beautiful part of the Lancashire Hills. I congratulate him on his maiden speech and welcome him to this place. My honourable friend, the member for Birmingham Erdington, talked about his time prior to this, prior to his service in this House as Deputy General Secretary of the Transport and General Workers Union and then Unite. What he didn't mention, Mr Deputy Speaker, was at that point he was my boss. And I always try and follow what he suggests. And he was urging us in this House at this time of national, indeed international crisis, not to be too political. So I will do as my former boss suggests and try and take some of the criticism out of the budget. This was, in a sense, two budgets. There was the budget that would have been given in normal circumstances, but then there was the emergency resolutions and the emergency provisions that were brought in to tackle the coronavirus crisis, and we welcome those provisions on this side of the House. as my honourable friend from Ellesmere Port and Neston has earlier indicated, and will work with the government to achieve that. But one of my concerns that we have in this, within this context is that after 10 years of cuts to public services that are already running to the bone and running basically on the goodwill of public sector workers, that public services will be under particular strain. And I want to mention a couple of areas, if I may, in the short time available to me. The first is social care, and I was concerned that there really wasn't any provision for additional social care money made in this budget, but furthermore there was no answers to the social care crisis that we are facing and have been facing for a good while. As the cost of social care rises, the chronic lack of central government funding is pushing families to breaking point. Unpaid carers are on the front line of the social care crisis, taking care of family and friends who wouldn't cope without their daily and sometimes hourly support. By cutting the amount of cash to provide to councils, the government are gambling on the goodwill of carers, friends and families to plug the numerous holes in our deficient and sometimes ineffective social care system. The situation is unsustainable, causing stress and in some cases mental health problems for carers due to the physical and emotional exhaustion of their caring role. And social care is getting more expensive. Children's lead are complex, with some costing £4,000 per week. Families cannot face these costs, and nor can local authorities. If I might move on now to a second subject, which is particularly relevant to Chester, it's the status of heritage cities. Chester prides itself on its rich Roman history. Walking along the Roman walls, when they haven't collapsed, or through the historic city centre is an experience that attracts around 8 million visitors annually to my city and my constituency. And when Cestrians come together to celebrate and protect our heritage, great things happen. The recent reopening of Chester Castle after 7 years of closure is a huge step forward. I'm delighted that visitors will be able to visit the top of the Agricola Tower and see the city skyline this summer, this current crisis permitting, Mr Deputy Speaker. Assets such as the Roman walls, Dee House and the old Dee Bridge form a part of English history and must be preserved for future generations. Yet the government have taken the rug from underneath local authorities, causing great difficulty, in particular for heritage cities such as Chester and York and others. Chester does not receive any special funding to maintain crucial heritage assets. For example, the only support the council get to maintain the Roman walls is taken from the local transport budget or their own asset recovery. A limited amount is provided by Heritage England, but not a penny is allocated directly from government. This means that Cheshire West and Chester Council, our local authority, is being forced to choose between protecting our ancient city while providing basic services for the people who live within the walls. Communities should have the opportunity to celebrate their culture and history, but funding has been so deeply eroded that its historic sites will not be able to be maintained. You can't run a modern society on the cheap. These cuts have consequences, and if I have a major broad brush criticism of the government, it is that money is taken away from local authorities, which then have to put up the council tax in order to pay for the deficits. And when those local authorities put up the council tax, they're blamed for putting up the council tax and have to take the political hit that is not their fault. Ministers talk about an increase in spending power for local authorities, but that increase in spending power is almost entirely as a result of council tax going up, and as I say, the political criticism is then given to local authorities. It's not just Labour councils who are suffering. Honourable members opposite know that the cuts are making the lives of their constituents worse too. Less cash, fewer services, limited support. Every single council in the UK is struggling, and I urge ministers to address this and the question of social care, which is dragging councils down by the millions, so that at least some kind of equity in funding can be returned to the local authorities which deliver so many vital local services.
It's a pleasure to call Nick Fletcher to make his maiden speech.
Deputy Madam Speaker, I thank you for letting me speak. A maiden speech, no interruptions. Oh, I do wish I could have one at home. I would like to start by telling you a story. Now, it starts a little sombre, but stay with me, it does brighten up. So if you're sitting comfortably, I will begin. I'm going to tell you a story of a 10-year-old called Tommy. Tommy goes to school every day, like most other kids. He sits in his class with some other 10-year-olds. He doesn't like it too much, but it's okay. Tommy's handwriting is pretty good. It's better than mine. So a teacher somewhere over the last 6 years has done a good job. However, Tommy is in a special class now. Not special good, but special because Tommy gets bored and messes about. He messes about more than most. Tommy knows he's in a special class, and although never directly told from the adults in his life, he pretty much knows he will get nowhere. Tommy, outside of school, doesn't do much when asked. So you'll press a little further and ask again, only to find out Tommy smokes weed. Not good for a 10-year-old, is it? He doesn't really want to, but it impresses some of the young men who stand outside his school gate and around the shops waiting for kids like Tommy to come along. So what does Tommy's life look like at home? Well, just let's say it's dysfunctional. So no good role models here. The man who gave Tommy some cannabis, he's 22 and drives a car. Tommy thinks he's pretty cool. Tommy spends more time with this man than he does with anybody else. This is Tommy's role model. After a year or two, Tommy starts running errands and carrying a bit of drugs. He likes to impress his role model. We all like to impress, don't we? So fast forward a few years. Tommy is now 16, doing quite a bit of dealing. He's quite the young man on the street. People know Tommy and he likes the attention. He starts carrying a knife. His mum tells him off because she's seen it, but he tells his mum to go away, but doesn't say go away. He uses the words the adults in his life use. The police are watching Tommy. Everybody is watching Tommy. Tommy has a girlfriend. His girlfriend, a sweet little 16-year-old, starts taking a bit of drugs because Tommy does. She likes to impress. We all like to impress, don't we? I don't need to continue for you to know how this story ends. Not much of a story, is it? It's not a good story, but guess what? This is what happens when we have the wrong role models, when we try to impress the wrong people. There is another story. There is another Tommy who's 10 in a special class, whose writing is better than mine, but when asked what he does after school, he tells you he plays football, and he's good at it. He's no longer a special kid for the wrong reason. He's special for the right ones. His teacher tells him he's going to do great things. He has a great role model at football. He tells Tommy to go to the gym when he's not playing football, where there is another great role model. Tommy's school organised a visit to the airport to see a bomber called the Vulcan. Tommy enjoyed the trip to the airport and wants to learn to take a plane apart and put it back together again. Now we have Boeing in Doncaster and Tommy gets an apprenticeship. Tommy's life is looking great. Isn't that a better story? And it's not just about Tommy, it's about Rachel and Mia and Mohammed, who work at the Yorkshire Wildlife Park, Polypipe or the new hospital. It's about having great role models. It's about everyone raising their game, about teaching kids that there's a right way and a wrong way. That having dreams and goals are necessities in life, not luxuries. It's about following what you believe in, like one of our many notable folk in Don Valley, from Austerfield, William Bradford, who sailed on the Mayflower to follow his dream on a pilgrimage to the new world we now call America some 400 years ago. It's about giving a town pride in itself. Can you imagine how the people of Don Valley felt when a castle was being built at Conisbrough in the 11th century? That was the last time we had some serious investment in Don Valley. It's around the same time that we last had a Conservative MP. Oh no, bear with me. We've never had a Conservative MP. Can you imagine how the people of Doncaster will feel if and when a new hospital is built, when flood defences are put in place so their homes are not flooded every 10 years, when a new rail link is built to Doncaster Sheffield Airport, which will attract huge business and create thousands of jobs and homes? We need these big projects to raise the aspiration of our young, to raise the hope of our families, and to let people know we care and that they are not the forgotten communities anymore. But most of all, we need to hold ourselves accountable, to take responsibility for our actions and become great role models. and that must start with me here, and that costs nothing. Well, I am from Yorkshire. My predecessor and I differed on policy, but we did have one thing in common. She cared for Don Valley. I know this as I heard many a kind word on the doorstep about Caroline Flint when I was campaigning, and that continued on my arrival here. What seat are you? You all asked. Don Valley, I replied. Oh, that was Caroline's. We liked her. I say, I know. Caroline gave 22 years of her life to this place and the people of Don Valley, and on behalf of Don Valley, I say thank you. Yeah. With the doubling of flood defences, I know Caroline cared, and that's what I'm going to do here. Care by giving Tommy hope of a better life, and this budget will help do just that. With the doubling of flood defences, letting families keep more of their money by investing in infrastructure and the new hospitals and giving £8 million for football clubs, Tommy stands a chance. We are heading into some unknowns, and I appreciate that. But as a businessman, I have read and listened to many gurus, but my favourite is the late Jim Rohn, who stated in life, it's not the direction of the wind, it's the set of the sail that counts. So let's set our sail right, let's get behind this government and be positive about everything we say and do. And this includes dealing with the issue of the moment. By being the voice of reason, keeping calm, keeping to the facts and staying on course, we will come through this together. Yeah. Finally, I said in my acceptance speech that winning was nothing short of a miracle. I believe in miracles and I believe in God. I know not everyone does, and I know many see Christianity as a stumbling block to their way of life. But please remember, it is my way of life. It is the reason I believe I am here, not to judge or condemn, but to listen, to help, to be kind, to forgive and forget. And therefore I have two asks. First, will all the people here and back in my constituency forgive me when I get it wrong? And I will. But secondly, and much more importantly, however long we are here, let's keep room for God in this place. If we do keep space for him in the hearts and minds of the people who believe, I know this country will continue to be the greatest place and continue to be a place that you and I are proud to call home. After all, I believe Christ is the greatest role model anyone can have.
Madam Deputy Speaker, it is a pleasure to follow after the Honourable Member for Don Valley, who has delivered an excellent maiden speech, and I look forward to listening to many, many more speeches from the Honourable Member. This budget has been dominated by the coronavirus crisis we are currently facing, and rightly so. Coronavirus represents an unprecedented challenge for the UK, and now more than ever, we need to strengthen the safety net available to the most vulnerable in our society. As the coronavirus pandemic unfolds, more and more people will be in need of this social safety net than ever before, especially those who aren't eligible for sick pay or who have unstable jobs. For many of these people, the initial 5-week wait for the first universal credit payment could cause real hardship. It is a well-documented fact that the 5-week wait is already pushing vulnerable people to food banks, trapping many in years of debt, and making outstanding issues with housing, ill health, disability, and domestic abuse significantly worse. I, like many other colleagues, welcome the government's hardship fund of $500 million for local authorities to help deal with the coronavirus outbreak. However, I remain concerned that the local authorities lack the capacity or resources to effectively distribute this funding, thanks to a decade of austerity and cuts. The coronavirus outbreak exposes a deeper crisis faced by the UK. That is a crisis in our public services, which sadly this budget failed to address. Over the past 10 years, consecutive Conservative budgets have created and created a social emergency. As a result, our social security system is punitive, complex, and as mean as it ever has been. In numerical terms, the emergency we face is truly shocking. Today, there are now 4.5 million children growing up in poverty. This morning, 281,000 people woke up without a roof over their head. And 1 in every 50 households are forced to use food banks in order to eat. Last week's budget was loaded as the most generous we have seen in decades. But in reality, it does nothing to relieve the hardships inflicted on my community by 10 years of austerity, universal credit, the bedroom tax, and the benefit freeze. The Chancellor has let down my constituents by taking no significant action to tackle the inbuilt injustices which plague universal credit. Last week's budget said nothing about abolishing the 2-child limit, the 5 weeks delay in universal credit payments, or the benefit cap. Each of these actions would have an immediate and positive effect on my constituents, including the 52% of children living in poverty in Manchester Gorton. So why won't the government commit to any of these? On a more positive note, the budget did take some important steps on the road to tackling the housing crisis we are facing in the UK and in Manchester Gorton. I welcome the government's announcement of more money to support rough sleepers, their commitment to the Affordable Homes Programme, and the lowering of borrowing rates for councils to build social homes. But this doesn't by any means go far enough. Local housing allowance rates are scandal. 1.4 million households in the UK now claim LHA to help meet some or all of their housing costs. However, the impact of cuts and a 4-year freeze means they now do not cover even the cheapest third of rents in the 97% of areas in England. In Manchester, the average monthly rent has increased by 38% in the last 5 years alone. The skyrocketing cost of private rents and the freeze on LHA has made it near impossible for many people in my constituency to find an affordable home. On top of this, in my constituency, we have seen a significant increase in the number of LHA claimants who are refused rented accommodation by private landlords or letting agents. This is blatantly discriminatory, and I hope the government acts to stop this practice before more vulnerable people are pushed into homelessness. Although I was pleased to see the government announce back in January that LHA was to be unfrozen, this will not come even close to covering the vast shortfalls people face when paying their rent. The budget was a missed opportunity to raise LHA rates in line with the private rental market and prevent more people from falling into homelessness. While I welcome the £12.2 billion for funding allocated to the Affordable Homes Programme, I'm concerned about the Chancellor's definition of affordable. My definition of affordable housing and that of my constituents seems to be at odds with the government's. As they say, the devil will be in the detail. So I look forward to gaining clarity on how much of this fund will actually be spent on delivering genuinely affordable social housing. Deputy Speaker, let me finish with a final observation. My constituency and communities up and down the country have experienced 10 years of immense suffering thanks to rampant austerity. With our economy now unstable and more vulnerable than ever, it has never been more important to invest in people and the social safety net that protects them. Thank you. Yeah.
It's a pleasure to call Lia Nici to make her maiden speech.
Thank you, Madam Deputy Speaker. It is with great pride that I'm standing in this place and speaking about the town of my birth and now the town of my constituency, Great Grimsby. I'm equally proud that I am the first woman from my party to represent this seat. Indeed, I'm the first Conservative MP to serve the constituency since Sir William Walmesley in 1945. I would like to acknowledge the work of my immediate predecessor, Melanie On. Melanie served as MP for 4 years. Even in that short time, she progressed to shadow frontbench positions, firstly as Shadow Deputy Leader of the House and then as Shadow Housing Minister. Melanie was hard-working and diligent in her service of Great Grimsby. I must also mention, though, the Labour politician who served Grimsby for longer than anybody else did, and that is Austin Mitchell. Austin was a Member of Parliament for 38 years and is a politician whom I admire greatly. He once said that if you pinned a red rosette on a donkey, the people of Great Grimsby would vote for it. Well, Madam Deputy Speaker, I neither wore a red rosette nor am I a donkey. So what that proves is that Austin Mitchell wasn't always right. Austin was a constant campaigner against the common fisheries policy and the damage it inflicted on the fishermen of Grimsby. It is this part of his work that I will be particularly proud to continue now that we have left the EU. Yeah. I would also like to say a sincere thank you to my honourable friend, the Member for Cleethorpes, who encouraged me to stand as a councillor and then as parliamentary candidate. And my honourable friend continues to be a valued advisor and a huge support. Yeah. Madam Deputy Speaker, Great Grimsby has a long and proud trading history. The town was well known as a trading port in the 800s and was particularly renowned for the quality of its fish and its fishing fleet even then. By the 1100s, the town had become one of the most richest trading ports across the country. And in 1201, the burgesses of the town bought the town from King John, and it gained its first town charter in that same year. I'm very proud to be able to say that Great Grimsby was able to send 2 of its burgesses to start up the model parliament in 1295, and in recognition of that, the coat of arms and the name Great Grimsby is part of one of the stained glass windows in St Stephen's Hall. The enrolled freemen of Grimsby, who were created at the signing of the first town charter, ran the town until 1831 and are still an important part of the town's functions today. They are the beating heart of Freeman Street and continue to work with the council and MPs to ensure the town's positive future. It's important to recall how the Freemen encouraged economic success in the 1300s. They reduced and abolished taxes for local businesses. Yeah. For example, no quayage on loading or unloading ship. No stallage on erecting a stall in the market. And no anchorage on dropping anchor. Madam Deputy Speaker, I would like to encourage the Chancellor to emulate our forebears and bring a free port to Grimsby. For centuries, trawlermen from our town set off into the North Sea to catch the fish to feed the nation, including through 2 world wars. These trawlermen then had to suffer the cod wars with Iceland, together with crippling oil prices in the 1970s. As a nation, we then joined the common market and then the EU, which gave rise to the common fisheries policy. EU trawlers had access to our waters, and our own fishermen became subject to smaller and smaller quotas. All of this resulted in the decimation of the fishing industry in towns like Grimsby. But now we have left the EU. My constituents will be watching the government and myself very closely over the coming year, and will make sure that we negotiate a deal which means that we're able to build a UK fishing industry fit for the 21st century. But Great Grimsby isn't merely a town that looks back to its history. Our key Lincolnshire location on the bank of the Humber Estuary and facing the North Sea means we are home to the largest centre for seafood processing and cold storage, and we have become the UK's largest centre for the maintenance and operations of our new offshore wind farms. Many of my constituents also work at the port of Immingham and Grimsby, the UK's largest port by tonnage. We hopefully will also be at the forefront of leading the new technology that is emerging in the field of carbon capture and storage. I was particularly delighted to hear the Chancellor's announcement of an £800 billion infrastructure fund for carbon capture and storage clusters. And where better to place a cluster that will capture and store 16 million tonnes of CO2 than off the coast of Grimsby. And as my honourable friends on this side of the House will know, it's small businesses that are central to the life of our towns and of our country. If we are to encourage regeneration of our town centres, then our local businesses are key. So I welcome the announcement to help small businesses cope with the potential extra costs of coronavirus by refunding statutory sick pay. The retail, leisure and hospitality businesses in my constituency will also welcome the extension of the 100% business rate relief in 2021. I'm particularly pleased that the Chancellor has decided to freeze fuel duty for another year. My constituents, especially those who run logistics companies, will greatly appreciate this step. Madam Deputy Speaker, to be elected to represent my hometown is the greatest honour of my professional life. It is an honour which has come to me because of how the people felt treated by politicians in the past. And we know that they have lent us their vote. And I'm well aware that they voted for change, and I will work tirelessly to see that that change happens.
Dan Jarvis.
Thank you very much, Madam Deputy Speaker. It's a great pleasure to follow the honourable member for Great Grimsby. She conveyed her passion and her commitment to her constituents and to her constituency. We on this side of the House remember her predecessor, Melanie On, with great affection, and we're grateful to the honourable member for mentioning her. But on behalf of the whole House, I wish the honourable member for Great Grimsby all the very best for her endeavours in this House. She's made a powerful maiden speech on this important occasion. Madam Deputy Speaker, this is the budget debate, yet as the Chancellor and many other members have acknowledged, the only issue at the front of people's minds at the moment is the coronavirus. I know that families are concerned about their children and schools. I know that small businesses are worried about their survival, and I know that carers are very concerned about the elderly. We now have 20 confirmed cases of coronavirus in South Yorkshire, and I want to take this opportunity to reassure my constituents in South Yorkshire that the best preparations are being made to keep them safe. For that reason, Madam Deputy Speaker, I won't be able to attend the wind-ups later on, for which I apologise, because I need to be in regular contact with our Directors of Public Health and the Local Resilience Forum to ensure that our public services have the support that they need. Last week, we convened a task force in the Sheffield City region amongst...
Can we have a bit less chattering, please? Dan Jarvis.
Madam Deputy Speaker, I was just saying that last week we convened a task force, the Sheffield City region's local authorities and chambers of commerce, to ensure that we can respond quickly to support our economy, in particular our small businesses, through this challenging time. And while the Chancellor made welcome steps to support people and businesses financially, what I want to talk to in the short amount of time I have available today is something that we cannot put a price tag on, but matters just as much as the measures that are putting in place to deal with this emergency. Last week, we were promised millions for trains, roads and potholes, our transport infrastructure. Yet, in the face of a pandemic, we are quickly realising we rely on something far more important, our social infrastructure. This is our key workers and our carers on the front line fighting the virus. They are the fabric that knit our social infrastructure, our society together, helping to keep us safe and healthy. Underpaid, overworked and often little thanked, they are helping our most vulnerable through this most challenging of times. They are the social fabric which makes Britain strong. They are the reason I'm confident that we will pull together and see through this emergency. Our nurses and doctors have endured relentless workloads year after year, and now they are on the front line once again, putting their lives in danger. In our time of need, we rely on them more than ever before. So, Madam Deputy Speaker, in these uncertain times, in addition to the demands that the government to spend where it is needed, I want us all to offer something which is free, which unites us all and critically will support medical experts and frontline workers who are battling day and night to stem the flow of the virus. Because it is our national civic duty to keep our social infrastructure strong. Madam Deputy Speaker, it means looking out for each other. So I urge everyone to look out for and closely follow the expert advice. I commend the Chief Medical Officer, the Chief Scientific Officer, public health directors and local resilience forums who have provided calm and clear guidance. Second, Madam Deputy Speaker, we must look out for each other, showing a common decency in all that we do, checking on our neighbours, the elderly and the vulnerable who may not have family and friends to rely on. I saw this firsthand in South Yorkshire during the flooding last November. The worst weather brought out the best of people, and their selfless acts of generosity and kindness helped families to get back on their feet. We will need a similar effort this time around to keep us all safe. We must also look after our doctors and nurses and our carers by taking responsibility. Panic buying and stockpiling is not who we are as a country. It is not necessary. It makes it harder to protect the most vulnerable and in turn puts our people at greater risk of becoming ill. It adds unnecessary strain to our NHS and to its wonderful staff. It may feel like Britain has been fraying at the edges over the past few days, Mr. Speaker. Images of empty shelves have not helped matters. People are understandably tense and worried. As a country, we have been divided for too long. But through this crisis, I'm confident that we'll rediscover our common decency and kindness. Because now, Mr. Speaker, now is the time for leadership and for expertise. Now is the time to look out for each other. Now is the time to pull together. And I believe that we are ready to do just that and to keep our social fabric stronger than ever. The coronavirus will be a tough challenge, but by following our British values of common decency, respect and kindness, we have the best remedy to keep our families and our country health and out of harm's way.